We all started off at a time when psychiatric hospitals were mental asylums and psychiatric patients were mad people, Why is the doctors are being attacked day after day? Even during these COVID times when doctors have abandoned physical health, mental health, their families and worked so hard, so the society should change. That's why I'm making this, very angry remarks. It's not because I'm going to say, look here, I will not do service for the poor. Those who know me know what I do.
Welcome to our series, The Legend, where we bring to you luminaries who have made their mark in the fields of medicine and surgery. Our special guest for today is someone who is very dynamic, packed with energy, outspoken. He has no qualms in putting his opinions right out there. He has been awarded the prestigious Vishaka Oration Award for his outstanding contributions to the field of psychiatry. He has been the pioneer for introducing the concept of child psychiatry into his field of psychiatry. He is noted in being instrumental in instigating the shift of psychiatry into mainstream medicine. He has given multiple interviews in international channels, one of them being the CNN-IBN news channel that has called him the globally renowned psychiatrist. Today, we have none other than the legend, Dr. Philip John, with us. Welcome to the show, sir.
Thank you very much. I must thank at the outset the cohesive leadership of Cochin IMA and my brand new acquaintance and my incisive interviewer, Dr. Smita Menon. Thank you very much.
The past 40 years in psychiatry have seen the transformation from a concept of madness to today's concept of neurobiology or neurosciences. I've heard that when you started out first in Medical Trust Hospital, you broke new ground. You abolished locked cells, shut down shuttered wards. You opened up general wards for psychiatry. And if what I heard is true, you brought down psychiatry from the top floor right down to the ground floor, thereby destigmatizing psychiatric consultations. How did you accomplish this? That was quite a bold move.
You've done a lot of research on what you're asking me about. That's true. The transformation in psychiatry for the past 40 years, 45 years, has been parallel to what my career has been. We all started off at a time when psychiatric hospitals were mental asylums and psychiatric patients were mad people, It was a tough thing to change this stigma, this fear. Psychiatry was definitely the most stigmatized branch of medicine. People would not even accept it as a branch of medicine. That was the time. And then I must thank the Medical Trust Hospital and its founder, Dr. Verghese, for having given me the freedom to make the changes as I wanted, because there was a shuttered ward, as you said. And we brought it down to a division of neurosciences, to the C ward, the third floor. And the C ward had neurosurgery, neurology, and psychiatry. So it helped us to remove the stigma because psychiatry is nothing but neurology. I am one of them who believes that, maybe in another 10 years' time, there will be only neurology and no psychiatry, because psychiatry becomes part of neurology in terms of a reintegration. This was the truth some time ago. Psychiatry, as you said, is neuroscience. Psychiatry is the application of basic neurosciences, like genetics, epigenetics, like psychopharmacology, and the use of medications to change matters for a patient who is suffering from the changes in his brain cells, from the changes in his brain circuits, from the changes in his neural networks. So that's how psychiatry is perceived today. So what you said is true. We have come a long way in the past 4 decades. From, as you said, the concept of madness and fear to a concept of a dignity in a consultation with a psychiatrist. Because psychiatry has achieved a model that is brain-based. It's a brain disorder, nothing else. I have been, to some extent, called a pioneer and somebody who thinks out of the box. That's true. I think out of the box. That has been my history. Thinking out of the box, not really thinking alike with the common people who hold opinions. That has been my weakness, and that has also been my strength.
You completed your post-graduation in the most prestigious institute of our country in psychiatry, which is NIMHANS, Bangalore. You had the whole wide world out there as your playground. Why did you decide to make your mark in Cochin, in small Ernakulam of all places?
It is true that, having post-graduated from NIMHANS, I also had the option to continue in NIMHANS. I came home with the intention of going abroad to the United States like many of my contemporaries who are doing so well there now. But then my home situation and the situation that I had at the time, it made me decide to continue in Cochin. I chose Cochin because I belonged to a small temple village at the time. What was a temple village? Chottanikara. I actually literally grew up in the portals of the temple. അവിടെ ടെമ്പിളിൻ്റെ നടുമുറ്റത്ത് വരെ അന്ന് കയറി കളിച്ചിട്ടുള്ളതാണ് ഞങ്ങൾ കൊച്ചിലായിരിക്കുമ്പോൾ. I studied there in a Malayalam medium school. When we were in 8th standard, when I was in 8th standard around that time, we went through a very severe financial crisis at home. And then my father said, now the only way we can escape is actually for you to study well. And I did that. I worked so hard that somehow or other the Lord made it possible that I stood first among 300,000 children. I topped the SSLC examination. And then I thought I would probably go for IFS. That's what I wanted to know. I am a problem man. I like to create problems. People used to say, if there is no problem, Philip John would try it and create a problem and try to solve it. Because I have a keenness in looking at problems and solutions. And after this, it so happened that I got this first rank, and the press came home, and the press suggested that I would be taking medicine, and I said yes. And then they wrote in the next day's papers with that big picture of those days, in the front page of the newspapers, Adar Sevanartham medicine padikum. So that became my Achilles heel, because we had to actually go for medicine after all this. My father is the only one who told me, look here, don't let this rank in 10th make you feel proud, because if you feel the pride in your head, you wouldn't fare well in life, which is true. In 10th standard, if you score the first rank, then what is it that you gain? I don't think it's much. So therefore, I had to follow the path that was shown by my parents, and then I went in for medicine. When I came back, then I decided maybe it's good to give this Adara Sevanam a good shot in Cochin. And then Medical Trust, the director was good enough to offer me a post, and I literally recreated a department there, and the rest is my history.
It's interesting that you mention philanthropy. Do you think medicine or the practice of medicine has changed today?
Yeah, it's true. It's like a transformation that is forced on the medical profession. There are only two professions I hold really noble, and that is teaching first, far ahead, far above the medical profession, and then comes the medical profession. The society has to owe gratitude and compensation for teachers and medical profession. But today, what is it that you see? It's about 3 decades ago that there are certain acts that came into being, like the CPA, the Consumer Protection Act. Because of the individual drive of a legal luminary who thought that doctors had to be punished. So what did he do? He produced a concept of in this country, in our culture. That is what is important. It is not enough to talk about this without the background of the culture of this country, where this was a Guru-Chela relationship. And that was a sanctified relationship that was destroyed at one go, overnight, by bringing this Consumer Protection Act. The patient across the table became the challenger to your judgment. And then what happened? People started disrespecting the medical profession. And so did the media. Teachers, you look at them, look at the poor teachers. They are not even, at least some of the doctors make money. The teachers don't make money. So what is the society giving to them? Except putting them in shackles. And the same shackle has come on to the medical profession through various laws and various acts. The Mental Health Care Act, which is another thing. I have a lot to talk about it, but it's not the platform to talk about it. And the new Clinical Establishment Act, that's going to shackle us even more. It's going to make it impossible for doctors to practice in this country.
So are you saying that standardization should not be brought into practices?
Yes,
Isn't that what these acts are trying for?
Yeah, because you look at how health system has built in India and in Kerala especially. Why are our citizens so healthy? People forget the fact that people have gone out of the way to go to villages, to go to suburbs, practice there, create small units of clinics, small hospitals. At one go, all these will have to go, because only corporates can function here. That is a philosophy anyway that is going on in our society now. Everything for corporates. So what will happen with this is this. And the judgments. You see the judgments that some of the judges are giving. You're taking this as pure commerce. And then you give 2 crores compensation for a patient, 3 crores compensation, lakhs compensation. How much do you think I make in my lifetime? How can I be asked to give compensation when my judgment is reasonable? How can a non-medical person judge? You look at the Consumer Protection Act. How many of them, it's a judicial process, but how many of them are trained in the judicial process properly? How many of them are trained to actually establish the evidence from a witness who is not somebody who works with a lot of facilities in his hospital or in his teaching institution? That's how people judge that whether a doctor has taken a reasonably good judgment, which is all wrong. Ultimately, what is it that you should do? You should be able to actually practice comfortably in good faith. That good faith part has been taken away completely by this CPA, the Consumer Protection Act, and by the judges who interpret this act, sometimes maybe biased. I feel sometimes the judges are biased. You look at various negligences in other fields. Why is that they are not held by any law, any judge, anything? If the lower court judges that a man is guilty for somebody's death or whatever, is the lawyer who failed his client, is the lawyer going to be held responsible? Is the judge who made this judgment saying that the man is guilty, and it goes to the upper court, maybe the high court or the Supreme Court at great expense,
which is borne by
the poor client? Do you think the judge is going to be punished? Why can't the judge be punished? Because the law doesn't allow that. Why is that we don't have a law for legal negligence? It is legal negligence, correct?
True.
So why is that is not happening in the society? Why is that doctors are being attacked day after day? Even during these COVID times when doctors have abandoned physical health, mental health, their families and worked so hard, and those particular doctors, especially the young lady doctors, are being attacked in the middle of the night. Why is the community not responding? Why is the community not responding by saying this is wrong? Why is the media not responding? The വഴക്ക് പറഞ്ഞതിന് നേഴ്സ് കുഴഞ്ഞു വീണ് മരിച്ചു. That is the front page that you will see. Because doctors are always at fault. Because of a very major fault today. We stopped being a noble profession once the Consumer Protection Act came. We have no business to call ourselves noble. The society is actually manipulating and taking advantage of the medical profession by saying this is a noble profession. That's what I feel today. For everything else, there is the law. The doctor is culpable. But when it comes to striking for a better remuneration, doctors are noble profession. Doctors cannot strike. If doctors cannot strike, the society should automatically, spontaneously, suo moto, make a decision. The rulers of this land, the politicians, they should all take a decision. Doctors should be rewarded and remunerated properly. Then where is the need? You go to United States, you make enough money. Where is the problem? Here, you have 1 crore MBBS courses, correct? You have 3 crore MD courses. You have 5 crore DM courses. And what does the society have to respond to this? The colleges are charging this. Everybody knows this is all under the table. What do they do about all these deemed to be universities which are charging this much of this sort of money? I recently, during the illness of my wife, I met doctors who are doing the DM, to whom I had to ask, Betty, have you really passed your MBBS? Because that is the level of their information knowledge. Why? Because the meritorial system has completely been abandoned. And we are not functioning on merit. Why is the society not stopping that? Instead, why is the society trying to punish the doctors who charge? So that is my ultimate take on this. We are not judging ourselves with the quality that we are providing this community. We have to quantify our profession. We have to quantify the quality of our services, which we are not doing. You quantify the service. A lawyer charges 50 lakhs. Can you imagine? He comes from Delhi, he charges 50 lakhs, and the government takes the taxpayers' money and gives him 50 lakhs for that 1 hour of work. You think I can charge 50,000 if I save a life? Why is it that the society is not responding to this? The lawyer can take 50 lakhs, he is not responsible. I cannot take 5,000. The media will immediately say that I am doing this. So what I have been telling, even when I was president of the IMA here, I have been saying, it is time that we fixed our prices. Anyway, everybody is saying this is consumerism. If it's a consumer thing, then you are selling a commodity. Why do you price your commodity? If the lawyer can price, I had to take the legal service of a friend, a lawyer. I paid him 50,000 rupees for 3 appearances. That's the charge he sent to me with his clerk. Now, why is that? If we cannot take, doctors cannot take money. We are charging money upfront. And if you charge upfront, I think the society is bounden to do this. The government is running hospitals at the expense of the taxpayer to be able to enable services for the poor, correct? So why can't those who have money, why can't they pay? I had a man who came to the clinic and said that the charges are very high. Okay. I saw him one day coming back, looking at a bill from the beverages queue, and I called him and looked at his bill. It was 860 rupees. He has no problem. For his urinating next day morning, he is spending 860 rupees. He has no problem. If a doctor charges 860 rupees, it is it's blasphemy. Why is that we are not fixing? I think the IMA has to make a move that we fix our charges at higher rates, because 15 years of our youth we spent in these dark corridors of medical wards, and then you have no family. You are noble professions, you cannot ask for remuneration. You have to get beaten up day or night. And the society is not responding. The society today is not responding. Can you imagine? The media is not responding. Our politicians are not responding. The courts have to say, okay, doctors cannot be beaten. It's so shameful, isn't it? the shame should be with us, because we don't charge what we are worth. You start charging what you're worth, people will stop beating you up. Have you heard of a lawyer being beaten up because of his charges? Have you heard an accountant, chartered accountant being beaten up because of his charges?
No, definitely.
Never. So why are we being beaten up by the society?
So what you're saying is the tag of medicine being a noble profession.
It has stopped. We are not noble anymore. The whole problem is, we also in our meetings, we keep saying this is a noble profession. Why is it a noble profession? Why should it be a noble profession? I'm not saying it should not be a noble profession, but the society having treated us with these laws, the society having treated us with these judgments, the media having treated us with these judgments, and the judgments that they make in the media, it is actually many of the time on the media, I feel very hurt that even people whom I have helped, sitting there and saying that the doctors are at fault, this is a noble profession, they could not strike. Now why are you creating a situation where we have to strike? Why is that we cannot strike to ask for better remuneration? If a hospital has a fire in it, recently you have seen, the doctors are suspended. Doctors are responsible for the wiring of the hospital. Why are the doctors suspended? Nobody else is touched. The concerned minister should have resigned, if you ask me. So many people died. It doesn't happen. It will never happen, because doctors we are all soft targets. Because, if I shout at somebody, they will say, doctor, he shouted. Why is he shouting? He's a doctor. Then why is he creating, why are the people who come for the help of the doctors, why are they not keeping their level of communication? Why is the media not encouraging people to keep their level of communication for doctors and teachers? If they are not, then why are you treating yourself as a noble profession? You treat the patients as a commodity. You treat your services as a commodity. Anyway, they are saying patients are consumers. Did you see a report in the paper the other day, just last week?
Regarding what?
Regarding a lady who is 20 years old, gives a case against the doctor, saying that she should not have been allowed to be born.
Yes, sir.
You read that? And the doctor is sued for compensation, and the court has allowed compensation. What sort of justice is this? What are we talking about? So what has happened is, none of our children wants to go for medicine, correct? Those who have anything here, they will run away from the concept of going for medicine. Only the breweries send their children for medicine. The gold and the sari sellers, they send their children for medicine. The nurses, when they go abroad and make some money, they send their sons and daughters for medicine. I am not saying this for pulling out professions. I am saying the meritorial choice of medicine as a profession, that is stopped somehow. That is stopped somewhere. So you treat the society the way the society treats us. That's all I'm asking. But it is not to say the negative things. Please don't misunderstand me. I'm saying this so that the society begins to respond to the service of the doctors, and far above that, the service of the teachers, with respect, with gratitude. It is not like, absolutely, and the remuneration, of course, because we have to have we have to have a style of living. We also have to have a style of living. Why is it that I can't have my style of living? It is not for the style of living I am saying this. The society has to have some gratitude in it for these two professions, which are not adequately remunerated, because we lose, you look at the doctors, you lose at least 15 years of your life studying, correct? Working hard from 8th standard probably, because of the this terrible entrance system that you have. So where are you? So the society should change. That's why I'm making this, very angry remarks. It's not because I'm going to say, look here, I will not do service for the poor. Those who know me know what I do.
So the pathways that have been set by Sushruta or Hippocrates is definitely obsolete and outdated as per today's picture of medicine?
I don't know, because, Hippocrates said you don't take money from another doctor's child because, you are brothers in the profession. I've never been given any such preference. So society has changed. So you have to probably change with the society. I'm not sure. I'm not sure because I have come to the fag end of my career. I'm an end of career psychiatrist, an ECP. So if I'm an end of career psychiatrist, I should actually leave this for the next generation. Because it's very sad the way doctors are treated by the society, who think the second thing that they do once they come to the outpatient is beat up.
If I call you a rebel, would you say that is true?
Well, rebel has a negative connotation, I suppose, but then that's not really what I have. I look for change. I have looked for change in my entire life. The concept that many people have had about me is that I think out of the box about many things, and I have a spine with which I talk.
So you're saying the other doctors don't?
I am not saying that. I don't see that much. I'm very sad that I don't see that much. In the Golden Jubilee celebration of NIMHANS, Dr. Shekhar Seshadri introduced me to the audience as the man who calls a spade an axe. There may be material in it, but you must call a spade, but much more than that, when you see an axe, you must call it an axe. Na?
True.
So that's what I have done. Maybe it's true if you take my Trivandrum Medical College life and subsequently NIMHANS life, and maybe to some extent when I started my practice, I've been different. That's why I've been able to pioneer so many things. Pioneering so many things, the time I have gone through has been difficult because there is so much stigma, there is so much resistance. It was not like these days, when you could say something and get away with it. And it was, there's a lot of resistance to change.